Thank you, Chairman. As a member of the subcommittee, I've been really proud to stand beside my colleagues who recognize the importance and the value of investing in mental health support programs. So thank you, Chairman, for this committee hearing. We really are at a critical moment where mental health is at the forefront of hearings, of discussions, of roundtables across several congressional committees, obviously including this one. And why? It's because the communities we serve, they can't wait no longer. We have the ability to treat and provide support for these struggling with mental health, and we have to use every single tool in our toolbox so that we can ensure that these resources are widely available and that they're known. I can't emphasize enough that as a member of this committee, we're advocating for all veterans. And that includes women veterans, that includes veterans of color, and certainly disabled veterans. Every single veteran deserves quality, accessible mental health support, especially while they're going through the process of transitioning to civilian life. And supporting our veterans means we have to support them through these transitions. And we have to equip them with the resources, including mental health support, to ensure they can live a full and happy life. So my question is for Ms. Cohen. Ms. Cohen, my concern is that the VA has all of these resources available, but not everyone is aware of them. Actually, quite a number of our veterans don't have access to this information. So what are you doing to do a better job at ensuring awareness of the resources, the services, and the benefits available to them?
Thank you for that question. There's a number of things outside of the TAP course where we provide comprehensive outline of all the benefits and services. But if you are not able to attend TAP, or maybe it's been now a long time, we've now started an off-base transition training where it's a virtual opportunity to hear about our benefits and services again. We've also implemented a new outreach strategy where we have worked with all the 56 regional offices, and we've asked that they come forward with a plan that's data-informed, that they better understand their communities. In FY25, you will see a focus on counties that have never received outreach before. We're also asking for increased stakeholder engagement. The three top topics will be homelessness, rural communities, and focuses on women for FY25. So those are a few of the examples of how we're stretching and trying to reach more veterans.
Thank you, Ms. Cohen. And I guess this question is almost a follow-up, but this one is for Ms. Cohen and Ms. Orsiga. Can you both explain how the DOD and the VA are ensuring that transitioning service members, especially those with unplanned or unexpected transitions, and those with disabilities, are provided the access and resources to all the benefits available in the short time they have before exiting the military? And I guess we can start with you, Ms. Orsiga.
Thank you again for the question. I think one of the things, first of all, is, as we previously mentioned, is we have mechanisms in place where the Department of Defense, the in-transition program particularly that I can speak to under Health Affairs, has connections and really starts to look at connecting with the folks on the VA side in terms of bridging those gaps and leaning in. I think also, I would say, is each separating service member is not a one-stop shop, meaning it's each individual is different, has different needs and different resources. And so in the time that I've come on board, I've talked to a variety of different staff across the department and those inside of Health Affairs and outside in the military departments, and really to try to look at those resources and, as you pointed out, kind of bring all those tools together so that we are capitalizing on not just one-stop tool, but multiple tools and resources to tackle the behavioral issues.
Great. Ms. Cohen, when you answer, because our time is running out, can you also answer this last question I have here? Are there plans for the DOD and the VA to allocate additional resources to enhance mental health support available during the military to civilian transition? So we can speak to that as well.
Thank you so much. Very quickly, we try to reach every single veteran that transitions to your first question. So some of the successes of Solid Start are we're going to email them and talk about the benefits. We give them a welcome packet. We talk about it in TAP, and we're going to call them 21 times if needed to connect. It is a priority for our organizations to collaborate and continue focus on this topic of mental
The gentlelady's time has expired. Mr. Ramirez, if you'd like a second round of questioning, I'm more than happy to do that.
Yeah, great.
Very well. The chair now recognizes Mr. McGarvey for 5 minutes.
Thank you, Mr. Chairman. Thanks, everyone,